We designed Ultra Hydrolift technique to gain some lifting on the face as long as you are regenerating the tissues. We will aim the 5 layers of the face, gaining lifting effect, hydration and regeneration. We need to place 10 different points along the line of ligaments. So first, we need to demarcate this line of ligaments. We will start demarcating the start of the line of ligaments with the superior temporal ligament, then the inferior temporal ligament, orbital retaining ligament, and zygomatic ligament, and mandibular ligament. As you can see, if we track this line, we can gain lifting down to the neck. We need to decide. We have 2 variants of this technique. We need to decide whether if we are injecting the temple or not. It all depends on how thick is the temple or if we have sunken temples. So the first injection point on this patient where we have sunken temples, we will be placed 2 centimeters lateral to the canthus and 2 centimeters up into the temple, into the center of the temple. The next 3 points we will place below the inferior temporal ligament, 1 centimeter backwards the zygomatic prominence, then 1 centimeter apart from the first point and 1 centimeter apart from the second point. The 4th point will be placed between these 2 ligaments, the zygomatic ligament and the orbital retaining ligament, and we will place this point passing the zygomatic prominence. The 6th and 7th point will be placed before the tragus, 1 centimeter and half before the tragus and 1 centimeter below. Then the gonium, and then will we place another point on a line that runs from the gonium to the interior canthus, 1 centimeter up. And the last point will be placed on the commissure, half centimeter below the commissure. And then you have the 10 points to be injected with 0.15 ml of bi-DENS. Now we will inject these 10 points. We need to be very careful. We have these lines saying that we have 0.3 ml on each line. So we will inject half of the line on each point. You need to be very careful when injecting because we want to aim the very superficial part of the subdermal tissue, which means 4 to 5 millimeters depth. So you will place the tip of the needle very superficial, and then you will inject half of the line, very slow, yet very firm. It is expected to have these little bumps. You will see what we will do after the injection. The 2nd point, very superficial, half of the line, superficial. What happens if you go deeper? You won't get the lifting effect and you will lose the product into deeper layers. Nothing to be worried about, but you won't get the reaction that we want to get with Ultra Hydrolift. After you finish the last injection point, you can integrate the product with a subtle massage on the skin, and this will help to integrate the product faster. If you don't do that, there's no problem, because the product will integrate itself after 24 hours.